Welcome, everyone. And thank you to those of you joining us live and those listening to this webinar afterwards. I'd like to also welcome our guests today, who I will introduce in a while. So our webinar today is entitled The Role of Pharmacists in the Prevention and Management of Stress. Stress is defined as any type of change that causes physical, emotional, or psychological tension, and it has been dubbed as the health epidemic of the 21st century by the World Health Organization. Stress is the body's response to any situation that requires attention or action, and everybody experiences some level of stress. However, high levels of stress may lead to various physical, mental, and emotional symptoms, such as muscle tension, headaches, fatigue, sleep disorders, irritability, increased heart rate, and difficulty in breathing. Chronic stress is also a risk factor for the development or exacerbations of non-communicable diseases. Pharmacists have an important role in helping people prevent and manage stress through pharmacological and non-pharmacological approaches. So our speakers today will explore all these issues in further detail. So for this event, I would like to first start by presenting myself. So my name is Filipa Alves de Costa. I'm an assistant professor at the Faculty of Pharmacy, University of Lisbon in Portugal, hence the light you see in the back is from a sunny country. And I'm also vice president of the social and administrative section of FIP. So for this event today, we are joined by a panel of fabulous speakers. And I want to sincerely thank all of them for taking their time in their busy agendas to join us and prepare their presentations. And have time to share their knowledge with all the participants we have online. So as you can see on the slide, we have some announcements to make. Please note that this event will be recorded, live streamed at FIP YouTube, and the recording will then be available at events.fip.org. To all of you that are listening, please feel free to send your questions through the Q&A box, which you can see on the bottom of the slides. And I will do my best to manage all these questions. Obviously, probably not all, but we will try to address them by the end of the presentations. You're also welcome to provide your feedback on the session using the email you see on the slide, webinars@fip.org. And I would also like to take this opportunity to promote the benefits of membership with FIP, including the ability to watch these events and webinars. FIP is the global body representing over 4 million pharmacists and pharmaceutical scientists. And if you're a pharmacist or pharmaceutical scientist and you would like to become a member, please register at FIP's website using fip.org. So for today, we have a program that's quite packed. We have 3 talks. The first one by Carol Spears, the impact of stress on our health and well-being. Then we have Dr. Martina Hahn, who will be talking about the role of pharmacists in the prevention and management of stress, pharmacological approaches, and pharmaceutical advice. And finally, we have Dr. Ricardo Sintra, a clinical psychologist, who will talk about the role of pharmacists in the prevention and management of stress using non-pharmacological approaches. We then have a time for questions and answers, wrap-up, and conclusions. So we have a number of learning objectives for today, and these are the attendee. So all of you, by the end of this session, will be able to learn about the impact of stress in our health and well-being, how stress can contribute to the development of exacerbations of non-communicable diseases, and the role of pharmacists in the prevention and management of stress. So with no further delay, I would like to introduce our first speaker, Carol Spears. She's a CEO of a leading UK stress management consultancy, a BBC guest broadcaster, a motivational speaker, and author of Show Stress, Who's Boss. She's chair of the International Stress Management Association UK, an international motivational speaker, and is regularly called upon by the international press for comment. And finally, she's also a founder of the International Stress Awareness Week. So with no further delay, Carol, the floor is yours. Thank you.
Thank you very much indeed. And I'm delighted to be here today, really, truly delighted. The impact of stress on our health and well-being. Well, stress affects everybody at different points in our lives all the time. We can't actually remove stress in our lives, but nevertheless, we can learn to manage it. And we all know what it's like in a situation where we have to do that. Right, can we move on to our slides, please? We all know what it's like when you go and see somebody and they say to you, how are you? And the chances are you say something like this word, something like, I'm busy. And that's what we very often say. It's very often said, we say that regularly right across the board. How are you? We are busy. We are busy. And is that how it's meant to be? Not necessarily so. Can we have the next slide, please? So there's busy. Can I actually do my own slides? I'd really like to be able to do my own slides so I can turn them off and on. Right, so we're busy. So yes, we are busy. What does actually busy mean? What does it actually mean? Well, it means that we are living in a world where we are truly busy. Next slide, please. And we wear this badge of honor. We wear this busy badge of honor all the time. And that's actually what we do. How are you? I'm busy. Badge of honor. Next slide, please. If I can do these myself, it'd be even better. So we actually experience what is commonly known as the busy executive syndrome. We're on that roller coaster we can't get off, we can't say no, and that's how we're experiencing it all the time, all the time. Next slide. And what do we become? Yes, we become an adrenaline junkie. We're not sleeping necessarily, we're not making time for ourselves, we're not giving ourselves me time, which is very much what we need to do. And then what happens? Next slide, please. And then what happens? Yes, you're right. You find you're on your way to burnout. Yes, you've seen the warning signs of stress, but you don't necessarily do anything about it. Everybody says to you, well, you know, you tell everybody that you thrive on stress. Oh, it's good for me. Well, it's not necessarily good for you. And then you say, you know how to beat the system. Next. Then your body breaks down. When your body breaks down, that's what happens to you. I'd like you to imagine a vase. Here is a vase. This vase has a crack in it. This vase has a crack in it, and so therefore it's not really fit for purpose because it was actually bought to take flowers and water. It's not fit for purpose because it's got a crack in it. This is what happens to our bodies. Our bodies have cracks in them. Next slide. It can happen to everybody around us it can happen to, whether you're A-class celebrities, B-class celebrities, or all of us. It makes no difference. This is what is actually happening. Next. Even as we saw at the beginning of the year, Jacinda Ardern, who was the 40th Prime Minister of New Zealand, she actually said to everybody there, I do not have enough left in the tank. Next. And because she said that, it was a very important point because she was the one person that was standing up and speaking out in front of everybody to say, I am experiencing burnout. So, next slide. Are you stressed today? I don't know, but maybe you do. Are you stressed today is a good question. At this particular moment, next slide. Now, at this particular moment, you may not be. You may be sitting in your office, you may be at home, it doesn't matter where you are. The signs and symptoms are very clearly there for all of us to see. Waking up at 3 o'clock in the morning, it happens to all of us. So therefore, we recognize the signs and symptoms, next slide, but we don't necessarily do anything about it. So recognizing the slides is fine. What do we do about it? Nothing necessarily so. Next. Now, if we look at this curve, you can see exactly where we are. On the one side, you have rust out, which is the boredom factor, which is stressful. And on the other side, you have burnout. Burnout is what anybody can experience. And at the very, very top of the curve, you've got optimum performance. Now, how long do you think you can stay at optimum performance for? A long or a short period of time? You're right, a very short period of time. We're vacillating from left to the right on a regular basis. Next slide. And we always can recognize, when we're experiencing burnout, because you're not just tired of an evening, but you're exhausted. You wake up in the morning and you haven't necessarily recharged your batteries. Now, there are many misconceptions. Next, there are many misconceptions about stress. Many people think stress is good for you. Well, it's not. Stress is not good for you, but it's also not a sign of weakness. Next, not a sign of weakness. And next, it affects everybody differently. So you may say to me, oh, Carol, what is the difference between pressure and stress? Next, very, very simply, pressure is what provides that stimulation for you. Pressure gets you up in the morning. Pressure is what you can manage. Pressure is what you can cope with. Next, but stress is the inability to cope. So stress, very simply, is too much pressure. Next, too much pressure when you start feeling inadequate. But we do use stress. We do use stress to do things that we wouldn't normally do. Standing up in front of an audience, speaking to an audience may not be what you love doing. How do you feel when you're in that audience? Probably quite quiet. You'll feel okay. All of a sudden, you get out of your seat, you come up to the lectern, you speak to everybody, heart palpitations, next, sticky hands. You think to yourself, I'm nervous, and yes, you are. And that's actually what's happening. When you get to that microphone, this is your short-term stress. Next, your short-term stress, fight or flight. It works for all of us. Next. But here's the big but. You need to turn off that light switch. You mustn't continue with that light switch on a regular basis. You need to know how to turn it on. Next. And you need to know how to turn it off. So let's look now at some tools to help you build your own personal resilience. Next. The first one is you need to recognize the warning signs. Next. You need to recognize the warning signs. Yes, they are there. They are there for all to see, and they're there for you to see. There's nobody here in this audience who doesn't recognize when they are actually waking up at 3 o'clock in the morning, or they can't get back to sleep. There's no one in the audience here who's not aware of feeling excessively tired, being angry. Next, or just feeling that you can't do something, negative thinking. It is true to say we are what we eat. We hear that enough times. And I wonder for yourselves, how much water are you actually drinking? Are you drinking your 2 liters per day? I don't know, but you do. Are you making your diet something that's really important in your life, that you know what it is that you're eating each and every day? Are you restricting your caffeine, or are you just drinking loads and loads of coffee? Next. Doesn't matter what it is, but the point is that we need to actually manage our diet and plan. If you're going to go traveling, plan what it is that you're going to be eating that very next day. So when you're making a dinner of an evening, actually then get to the situation where you plan what it is you're going to be eating for the next time at lunchtime. And number 3 is to take exercise. Why? Because it does reduce muscle tension. Next. It does improve the production of endorphins. Next, It improves our motivation. We go out, we go for a walk, we feel better after that. And then number four, very simply, is to get a good night's sleep. I know what you're going to say. It's not always that easy to get a good night's sleep. But by the same way that you actually prepare, you get up in the morning, you have to prepare yourself for bed, which is not getting to the point where you've got a situation where you just work until midnight, then think you're going to fall asleep, because the chances are that may actually not happen. You need to disconnect. You need to disconnect from all lit electronics. You may then say to your Carol, I use my phone as an alarm clock. And I'm going to say to you, well, you can still leave your phone outside the bedroom door, and you can use a very old-fashioned, I agree, a very old-fashioned alarm clock. Deal with your distractions, but make sure you unwind from the day. Next. Number five is to be mindful. Many courses about mindfulness. You can take a course, or you can get to a situation where you actually just want to go for a walk and just think about things. Walking, leaving your office, leaving your home, just time for you, ideally without your phone. Unless you're listening to a mindfulness app, then of course, then you take your phone with you. But it's really what we're trying to do is to get to the point where you don't actually have a need to have that phone. Let's be honest, the phone is an addiction, as we well know. Mindfulness can really improve our mental well-being, but it does take practice and discipline. Just to go out, to look at the trees. I'm in London. We're coming into spring. The flowers are coming out. Just to be aware that you can see what it is that's going on and look around you. Be aware of your breathing. Be aware of your thinking. Go for a walk and just have some thinking time. Be aware of the sounds that are around you. All these kinds of things are really very, very meaningful to you. Next. And then coming to number 6. Well, it really is important, and it's not a sign of weakness to ask for help. It is truly not a sign of weakness. So we need to seek help as and when we need it. A lot of organizations now have in-house mental health first aiders. A lot of organizations may have human resources. And one of the most important things is for organizations to look who the managers are, to make sure that the managers are the people who will listen to their employees. Now, managers today are usually promoted because of their technical skills. And I'd say to you, that's fine, that gets them that position. However, their listening skills, their EQ skills should be in balance with their technical skills. Managers have to manage people. And they are really the ones who really are at the sharp end. They're the ones who will pick up signs and symptoms in their teams before anybody else. So they're the ones we need to be looking at. They need to be trained. You may say to me, well, of course my managers are trained. And I'm going to say, not necessarily so. Next slide. Not necessarily so, because people are trained because of their technical expertise. But the managers are exactly the people who will pick up those signs and symptoms of stress early. Listen to that employee. Listen to what they're saying. Give them guidance. Give them some support. Let that employee know where they can actually go for help and assistance. So what are your takeaways? What are your takeaways from today's presentation? Well, there are lots of different things. Lots of things that you can actually take away. Whether it's your phone, to not have that plugged in, that could very well be the case. So not to leave that outside your bedroom door, outside your bedroom door. Could it be about your eating habits and thinking to yourself, I shall plan for tomorrow's meals the night before, so you don't get to a situation where you just grab a packet of crisps and run. So you actually know exactly what it is that you're eating. Is it about exercise? Well, you may or may not love exercise, but it's what our bodies need. Our bodies need to exercise. So therefore, you need to take an exercise, which you enjoy doing. Because if I said to you, go swimming every day, and you hate swimming, there's no point because you're not going to do it. So choose an exercise that you enjoy and then just do it. Good old Nike, just do it. And then we've got the on-off switch. Do you know where your on-off switch is? Do you know how to turn off your switch? Because we know how to turn it on, but then you need to know how to turn it off. And getting a good night's sleep so that you feel refreshed in the morning. You feel refreshed in the morning as if you have actually slept. You don't feel exhausted. You feel like you have recharged your batteries. And finally, mindfulness. You can take yourself onto a course or not. You can just be aware when you go out walking of your thoughts, your feelings, the sounds, everything that's around you. And just to walk and just to have plain, simple thinking time. Me time. What is your me time each and every day? I don't know. But out of all these tips and techniques, you could possibly see something that is going to be helpful for you, something that you enjoy doing. All we know is in the UK at the moment, 17 million working days are lost due to workplace stress, depression, and anxiety. I don't know what it is in your country, but I do know the UK are working very, very hard. We need to truly remove the stigma of stress, which still does exist. Next slide. It still does exist. So where do we go from here? It's been a journey. I've been on this journey working with people experiencing stress for countless years as a counselor. I've also been on this journey as a presenter. And does the journey continue? Yes, of course it does. The journey does continue. Is there stigma about stress? Yes, there is. Is it better than it was? Yes, it is. But we still have a long way to go. We have to create a healthy workplace culture. Your organization, it may be 2 people, maybe 3 people, maybe 300 people, needs to have that healthy workplace culture where employees feel that they can speak up and speak out about experiencing stress, where it's not looked as a stigma against them if they do. It is not a black mark against them. This is a sign of strength to say, hands up, I need help. So what have we looked at today? Well, we've looked at some of the we looked at the definition of stress. We looked at the definition of pressure. We've looked at what causes stress. And we've also looked at some of the signs of stress. What I'd say to you is, we are all aware of the signs of stress. The only question is to what are you going to do about it, and make sure you take action. We need to make mental health and well-being an everyday habit. It needs to become second nature to ourselves. And it takes practice and discipline. And finally, let's not focus on what's outside of our control. There are lots of things that are inside of our control. That's our own bodies and our cells. That's what we focus on. Thank you for listening.
So thank you very much for this excellent presentation. Please hold your questions. We have quite a few of them already on the Q&A. And let me just immediately pass to our next speaker, and we'll save the questions for the end. So our next speaker is Martina Hahn. She's graduated from the University of Marburg, became a Doctor of Pharmacy by the University of Florida and a PhD by University of Mainz. She then did a postdoc again in the University of Marburg and became professor in clinical pharmacy in 2020. Martina is a clinical pharmacist in psychiatry, which is not so common, for over 10 years now. So Martina, the floor is yours.
Thank you, Filipa, very much. We are working together at this special issue right now as an editor and co-editor at the International Journal of Clinical Pharmacy. So we work together quite a bit at the moment. I'm an ESCP member, and I founded the special interest group of the European Society of Clinical Pharmacy in mental health. And maybe not surprisingly, I'm working as a clinical pharmacist in mental health. And I will tell you what happens when stress, or you don't have your strategies to reduce stress and really get mental diseases. So what we want to focus on is the stress-related disorders, so the ICD-10 codes that start with a 4. It is adjustment disorder within 3 months after an event, acute stress disorder up to 4 weeks after the event, post-traumatic stress disorder, which is defined as longer than 4 weeks after the event, and anxiety disorders. Of course, besides these disorders, you will also find all other diseases of mental health that are exacerbating or that are aggravated by stress. So stress control in mental health is very important, and what we teach every patient who comes to see us, that they need to find ways, and you just heard the first lecture, great lecture, what to do and how to find the switch. So we teach all this also to our patients every day. We want to have a look at the medications that we use, that we can use. Of course, there is no anti-stress pill that's not existing, but we know that there are some neurotransmitters that are important in stress control. And it's the GABAergic, glutamatergic system, where it can be an imbalance towards the glutamatergic part. And also we have serotonergic and noradrenergic, as well as dopaminergic system that is involved in stress control. And we see these networks out of control when people are stressed over a longer period of time. There are also some medications that increase stress, anxiety, and agitation. So if you do a medication review in a patient that is very stressed, maybe even already mentally ill, you have to counsel them about the caffeine intake and also withdrawal symptoms of caffeine, because this can have negative impacts on the stress level. The same with nicotine. And also the cannabinoids, the THC withdrawal has negative effects. People are very stressed, dysphoric when they have the withdrawal. But you also see the asthma medications, for example. Sympathomimetics can increase anxiety, for example, and cause sleeping problems. Same with some antidepressants, the SSRI, SSNRI can cause sleeping problems. And you just learned how important sleep is in regards to stress reduction. We, of course, have the stimulants, especially in ADHD, but also, of course, kind of on the street as amphetamines that can be taken, of course, by people, same with cocaine. Theophylline, I didn't see it for quite a while now, but I hear from my community pharmacy colleagues that it's still out there a lot. We don't see it so much in the hospital though. And we have corticosteroids, which is our stress hormone. And so corticosteroids for a longer period can also cause an exacerbation of mental illnesses. What are the positive drugs that have a positive impact on stress level? And we will speak about them for the next 5 to 10 minutes. So you see them here. It's, of course, the benzodiazepines that we use as emergency drugs to help get the patient really to relax and to calm down, and maybe even to fall asleep if they're very agitated when they're coming to us. We have this SSRIs and SSNRIs, of course, especially in anxiety and PTSD disorders. Agomelatine, I will show you some data on this, relatively new antidepressant. We have the very old tricyclics, pregabalin, and also the low and atypical antipsychotics. that can be used in agitated patients and to help with sleeping problems. Let's first focus on the GABAergic drugs, which are probably very well known to every pharmacist. So I don't have to tell you much about the pharmacology. You see about 1/3 of all neurons are actually regulated by a GABAergic inhibition. So it's our most important inhibitory neurotransmitter. And we need a balance between the glutamate and GABA. If we're very stressed, we have a lot of glutamate and we cannot fall asleep. Our thinking is too fast. And so the GABA is missing. Benzodiazepines kind of regulate this. And the patients tell us that they're very calm and but also oversedated. The bad thing is that if those chloride channels are opened for a prolonged period of time, that we have memory problems, that we have risk of falls, and we have no ability to drive a car. So this should only be used in emergency situations, also based on the international guidelines these days in mental health. They should not be used on a regular basis, but still are overused, if you ask me. They should particularly not be used in panic attacks, PTSD, and other anxiety disorders, as they cause addiction very rapidly in these patients. I think the mechanism of action is quite clear, and you see what happens here if we start or we increase the inhibitory effect in the neurotransmission. You see a decrease in release of neurotransmitters if you take benzodiazepines. And the patients really like it, so that is dangerous. They cause the addiction. So again, only emergency use. You should not fill prescriptions for benzodiazepines for patients on a regular basis. Something is wrong. If you do that, the patient is probably addicted. No driving if taken. So this is very important counseling information. At least in Germany, the insurance will not pay if you had benzos. If you have benzos in your blood and a car accident happens. And you should never combine it with alcohol. It can cause respiratory depression, and also you will have a loss of memory if you combine these. We have an increased risk for falls, so very careful if you get out of bed, especially in elderly patients. So we now talked about the GABAergic drugs. So we increase the effect of GABA by benzodiazepines. But we have the addiction problem. On the other hand, we have the glutamate. Remember, we had the disbalance. And so what we can also do is regulate and decrease the released amount of glutamate. And we can do that by calcium channel blockers like pregabalin. So let's talk about pregabalin. Pregabalin is a calcium channel blocker, and it will decrease the release of glutamate, but it can cause addiction as well in patients with substance abuse disorders. So there were reports early after the introduction into the market that there are addicted patients to pregabalin. So you have to have a good history about drug addiction of your patients. It's especially in opioid use disorders, they have a big risk or a high risk, and that's why they should not receive pregabalin or gabapentin. This is important, but we can of course use it in anxiety disorders and PTSD. Usually the anxiolytic effect only starts above 100 milligrams per day. So I think this is important to tell the patient that with a starting dose of 25 milligram, it's not helping. So they should not expect what they maybe know from benzodiazepines. They take a pill and 30 minutes later, the anxiety is gone. This is not what's going to happen with pregabalin. We need to tapering up to at least 100 milligrams, sometimes even 300. to see a decrease in the arousal, in anxiety, in jitteriness. In the first time, that's why we need the tapering up. We see a lot of dizziness, sedation, and visual disturbances. They usually resolve after a while, but in the tapering phase, of course, this can happen. And of course, this also leads to a driving inability in this tapering up time. So we don't have the problem here because we see the patients in the hospital, but if you are from the community setting, please also tell your patients in the tapering phase they're not able to drive a car. There's a good benefit because there are very few or none drug interactions just with other sedating drugs and alcohol, but no ZIP drug interactions that are important. So it's actually a good drug to combine, especially in polypharmacy patients. Then we also have the SSRI and SSNRI, and what they actually do is that they change the thinking of the patients. It's what you see on the right corner, that we see more positive emotions and less negative emotions. So we have a change. If we activate the networks of serotonin, norepinephrine, and dopamine, we see that they sometimes can cope better with the stress that they have, that they cannot change. I mean, what, for example, work situation or problems with the partner, we cannot change that, but by the drugs, we can change a little bit so that they can cope better with the stress. The benefit is that they are not addicting. So this is really the first line treatment in all stress-related disorders are antidepressants. So they are used quite often in PTBS as well as in anxiety disorders, but it needs 2 weeks until they show their efficacy. So in the first 2 weeks, we have side effects. Only after 2 weeks, we see that they actually start by increasing the mood and having more positive emotions again, be happy again. So we see these changes really only after 2 weeks. Another drug, which is off-label, but I think it's important that you all know and can counsel your patients accordingly. Agomelatine has shown to be effective in anxiety in recent meta-analysis. I saw this in the beginning. It was introduced 2008 into the market, and we saw this. It was a clinical observation that especially patients with PTBS and anxiety disorder have a very beneficial effect from the drug. Not so much in depressive patients, which is the indication for the drug. That's the approved drug use is depression, but we tend to not use it too much in this indication because it's not working very well, but it's working very well in PTBS and anxiety. So the meta-analysis show this. Agomelatine is the most effective antidepressant in anxiety disorders, and this is why I think it will probably be in the guidelines very soon. We have some, and also it is very well tolerated. So the patients report very few side effects, which is also good in anxiety patients because you don't have the nocebo effects where the patient has all the side effects from the package leaflet. What else can we take as alternatives for acute agitation or also sleeping problems? We have the low potency antipsychotics, the classic first generation antipsychotics like pipamperone, melperone, chlorprotixine, levomipramazine, or pyrazine, depending on where you are in the world. And we saw that actually we have pharmacists from all over the world here today. So depending if you have these in your countries, you can use these because they're non-addicting. They're usually only sedating by inhibition of the alpha-1 receptors. So be careful, orthostatic dysregulation might occur, especially in the beginning of the therapy. So blood pressure control would be a good counseling point here. Melphalan, levomipramazine are ZYP2D6 inhibitors, so be careful about drug interactions. And pyrazine is a ZYP1A2 inhibitor. So again, perform a drug interaction check if those are the prescribed drugs. The second generation antipsychotics are also used for sleeping problems, anxiety, and agitation. Quetiapine is also recommended, for example, in a German guideline for anxiety, for generalized anxiety disorder, but it is off-label. It should only be used in bipolar disorder and depression and schizophrenia. But we use it quite often because it is not addicting, no dependency. Again, we have a no driving policy when it's only taken as needed. If the patient takes it on a regular basis, you might be able to drive a car again. And also orthostatic hypotension can occur. So again, blood pressure monitoring would be a good counseling point. In small doses, and this is what you see at the Stephen Stahl picture here, quetiapine is hypnotic in a low dose. In a medium dose, up to 300 milligrams, it's an antidepressant, and in the high dose, it's an antipsychotic. So make sure that you only use doses below 300 milligrams in those stress-related disorders, like anxiety, sleeping problems, stress, burnout, adjustment disorders. Be careful to not overuse it, not above 300 milligrams, because then you will see different side effects that we don't want to see. And it has properties that we don't need in anxiety and agitation. Another option, which is also off-label, is prazosin and doxazosin. These are also used in patients with a hyperarousal, especially during the night when they cannot fall asleep, when they are very awake and also have nightmares. Prazosin is not available in Germany, so we use doxazosin, but if you have prazosin, there's a lot more data out there that it helps with PTSD, nightmares, adjustment disorders, and so on. Especially the disturbing dreams, insomnia, on high alert, if the patient's already kind of doing this, if, for example, the door opens, this is the medication that can help relieve this hyperarousal effects very well. But again, blood pressure monitoring. There are, of course, blood pressure medications, alpha-1 blockers, and so please also counsel your patients about the blood pressure monitoring. So what is the role of the pharmacist? We can, in stress-related disorder, counsel, of course, the patient to get psychotherapy. Never use a medication alone. It won't help alone. So always in combination with psychotherapy. Counsel the patient about the drugs that are prescribed appropriately, explain addicting effect of the benzos to avoid the addiction, especially in the young generation now. We cannot change it in patients who are addicted since 1980, but we can make a change now in the young patients that have the first prescription for benzos. And in the interdisciplinary team, try to avoid the overuse of benzodiazepines. Counsel your colleagues about the risk of addiction and the new guidelines that recommend the use only in emergency situations and not on a regular basis. And take-home message, stress-related disorders should mainly be treated non-pharmacological. But if we need drugs, you just learned which ones. The SSRI, the SSNRI are first line, pregabalin and agomelatine might be suitable alternatives, but off-label sometimes. The low-potency antipsychotics can be used as needed medication, as sedatives at bedtime, for example. They are working very well. Prazosin and doxazosin, especially if there is a hyperarousal and especially if nightmares occur about the trauma, for example. And benzodiazepines, again, because it's so important, only in emergency situations, no regular use. And by this, I end my presentation and thank you all for your listening. And let's look at some of the questions, because I have to leave a little earlier.
Yes.
What we have.
Yes, Martina, if you allow me, thank you for this presentation. Indeed, we have some questions that are very much related to the pharmacotherapy, which I believe most of them you have already addressed in your excellent presentation. And these relate mostly to the benefits of medication in stress management, and particularly the benefits of antidepressants. But you have a very specific question now recently, which is about quetiapine and the use of it to being diverted to euphoria. It's the last question I believe you have on the Q&A. So the question is, I heard quetiapine can be diverted for euphoria, so thought not addictive. Is desirable for this reason? And if you can comment on this specific use of quetiapine.
I cannot see this question, unfortunately, in the Q&A. Quetiapine is recommended by the guidelines in anxiety disorder. And you said that it causes euphoria.
Yeah, the main issue is if it's addictive or not, and if for
Okay. If you ask me if it can be bought at the Frankfurt main train station, yes, it can be bought. It can be bought here at the train stations. Yes. Again, there might be an euphoria in patients at very high doses. It's anticholinergic. It's like all the anticholinergics that are used as euphoria drugs. The herbal drugs that can be used, I don't know the English terminology of those drugs, but there are plants that you can also use anticholinergics that can cause the euphoria. And this is the same with all anticholinergics. And quetiapine is anticholinergic in higher doses, and it is used by opioid addicted persons. But I've never seen an addiction in a depressed patient, schizophrenic patient. I've never seen this. But yeah, opioid use disorders. Yeah, there might be a problem there, but they take, of course, very high doses. It's not the dose in the package leaflet. Yeah.
Okay. And this is a difficult question because you're being asked to make a selection of the best anti-anxiety and the best antidepressant, specifically for the elderly.
Yeah, we just had a new release of our German kind of beers list. And here actually SSRIs are recommended. So sertraline, as well as duloxetine and venlafaxine in the elderly. Surprisingly, I was surprised when I saw this, but it's a huge publication, Priscus 2.0. This is called. So it's our German version of the beers list. So it's the SSNRIs that are particularly beneficial, as well as quetiapine in lower doses below 100 milligrams. Yeah. So
okay, and I will leave you the final question. It's about psychedelics and their potential use in stress. If you can comment on this on this potential.
Of benzodiazepines?
No, psychedelics.
Psychedelics. Yeah, there are some ongoing studies here. We also use ketamine, of course, in the university hospital. I would never use it in patients with PTBS or anxiety disorders because this depersonalization, so they cannot feel their body anymore. And also the reality kind of, is not clear to them. So we call it a dissociation. So they dissociate in ketamine use. And this usually causes a panic attack in patients who have experienced bad things. So you can use it in depression, but you should not use it in patients who had the trauma or have anxiety disorder or have psychosis or bipolar disorder. It's not not good in those patients. With psilocybin, I have no experience. We have one hospital who did studies. It was beneficial, but the setting with 8 hours, and a psychotherapist had to sit next to the patient for 8 hours. The setting just already tells you this is nothing that we can provide for all our patients to be there 8 hours for them, for only one patient. So this is not working very well. And the results are also not very clear, because some patients really had psychotic symptoms afterwards. So it did not always stop after 8 hours, but some had psychotic symptoms for several weeks. So I could not recommend it right now as a safe treatment for all patients in depression.
Okay, Martin, I thought it was the last, but I'll still give you a final one. Now it's the final. If you can comment on safety data about alternative medication used for depression or anxiety management, such as antipsychotics. And if you can be specific about certain population subgroups in terms of safety, what should we be concerned about?
Okay, the elderly with dementia have an increased risk of mortality if they take the antipsychotics. So this is shown by a lot of data, but this is only for dementia patients. So if it is an older, let's say, schizophrenic patient, we don't have the data. So be careful in dementia patients with antipsychotics. Always have the benefit and the negative effects on a scale and balanced. What other subgroup can I think of? In children, I see it a lot. From the data that we know from haloperidol and supersensitivity effects, I would be very careful in young patients with antipsychotics, because they might change the dopaminergic system, as we also change it with drugs. So in the time where the brain is developing up to 25, 26, use very low doses if you have to use it, and try to avoid the first generation antipsychotics because they have a larger impact on the dopaminergic development in the brain. I think these are the subgroups that I can think of right now. Pregnancies. There are a lot of good data about schizophrenic patients and pregnancies, so we should not stop the medication anymore during pregnancy. So I think now we have it all, like from the young to the pregnant to the old. I hope I gave you a little bit of answers on that.
Excellent. Thank you so much, Martina, and thank you for being able to answer all these questions. I think participants would need an extra hour just with you, but we have to move on. So thank you for your participation, and I'll call the next speaker, Dr. Ricardo Sintra. So he has a degree in clinical psychology. He's a PhD in neuropsychology and also honoris causa in neuropsychology. He has a post-graduation in cognitive behavioral therapy and also in management and human resources. He has additionally a degree in homeopathic therapy, and he's currently the owner of a pharmacy in Portugal called Moderator. So Ricardo, the floor is yours. Thank you.
Well, thank you very much for the invitation, and good afternoon to all the participants. So I will show you some data studies made in Portugal and Europe. And according to the study made by Workwell Corporate Wellness, the range of 31 Europe countries, Portugal is the 7th country with the highest range of stress work. And in the highest place is Chypre, and Liechtenstein with the lowest with 3.5%. In another study made by Each Night Sleeping Specialists, made Portugal the third most country with stress in Europe, having 77.13 points in a stress disorder scale. Usually the frequent reasons for high stress is sleeping disorders, memory loss and concentration, isolation feelings, anxiety and depression, work-related problems, such as lowest income, co-worker conflicts, moral and sexual harassment at work, lack of defined working functions, hours spent at work, balance between work and personal life. In a study made in Portugal by the Portuguese Psychology Order, the psychological risks are one of the main threats of mental health in workers and productivity with work violence, burnout syndrome, work addictions, mental overloads, and emotional disorders. The lack of boundaries between work and personal life, like the hours spent at work and the time spent going to work and going home, makes Portugal one of Europe's most stressful countries. The effects: depression, cardiovascular diseases, and muscular injuries. Long-term demotivation, performance and productivity, increase of absenteeism, costs in health service, and conflicts at work. The study also says that 53% of workers miss work days due to burnout, and only 10% of companies have real procedures to deal with the stress-related risks. The non-pharmaceutical approach. So what we do here is give the staff training to identify potential stress factors, non-verbal language, behavioral indicators such as skin rash, anxiety, hand and feet rapid movements, and nail biting. Provide environment stress to relief factors by stimulating other senses. So we have in the pharmacy, we have changed the wall colors to make the environment more peaceful for the clients. Specific space for stress approach. So we have a cabinet specific to take the clients when we identify the stress factors. Hair diffusers with the specific stress relief oils that will decrease the anxiety and the stress. And after identifying stress foreign to psychotherapy and occupational therapy with or without homeopathic approach. So I give you some studies regarding some products that I usually advise, non-pharmaceutical products. So it's natural and homeopathic products that are used mainly in the first symptoms of stress-related disorders. So here in this study, it's a comparison with a specific product called Nervoheal for an alternative to lorazepam therapy for mild nervous disorders. So in this study, 248 patients with insomnia, distress, anxieties, restlessness, or burnout, and similar nerve conditions. Patients were treated with this product or lorazepam, and at the recommended doses for a maximum of 4 weeks. The treatment effects were evaluated by a practitioner and in a dialogue with the patient at the start of treatment, after 2 weeks, and after maximum 4 weeks of treatment. So the sum of the symptom scores improved by 4.4 points with Nervoheal and 4.2 points with lorazepam. In patients who opt for a homeopathic treatment regimen for the short-term relief and mild nervous disorders, the effects of Nervoheal are non-inferior to those of lorazepam. In addition, the tolerability was rated as excellent by significantly more patients than that for Lisbon for 4 weeks duration of the trial. So it shows that we can approach the stress by not using always benzodiazepines. This one, it's also a comparison of the preparation Nurexan versus valerian treatment with insomnia. And so this was made in Germany, and the study had 89 German centers offering both conventional and complementary therapies. In a total of 409 subjects were enrolled and received the homeopathic preparation Nurexan or valerian for 28 days. Sleep duration and latency were evaluated based in patients' sleep diaries, and over 14 days, and sleep quality was evaluated at 28, more or less, plus 1 day. At day 14, both groups reported improvement, sleeping latency and duration, and sleep duration increased by 2.2 in Nurexan group and only 2.0 in the valerian group. The differences between the groups improved on sleep duration are significantly in favor of Nurexan therapy at days 8, 12, and 14. Significantly, more patients reported lack of daytime fatigue with Nurexan than with the valerian therapies. Nurexan might be an effective and well-tolerated alternative to conventional, so it doesn't have that much side effects. And valerian-based therapies for the treatments of mild to moderate insomnia. In this another study, it's also with the Nurexan, but I will pass through just to not make it too long, okay? And that's all. Thank you very much for your invitation and all the participants. Thank you.
Thank you, Ricardo. So now we can have a period of questions mostly directed at the first and the third speaker. So let me start by asking you a general question for both of you to comment on, which is how do you think stress management can help prevent chronic non-communicable diseases? And perhaps if we can have Carol first, giving the floor to the ladies first, and then Ricardo can comment after.
Yeah. All right. Can you repeat the question?
Sure, I can. How do you think stress management can contribute to prevent chronic non-communicable diseases?
Okay, right. We're happy with that question. It can help because it's a matter of actually looking after our bodies, looking after ourselves. So we have to take responsibility for our own personal bodies. And so therefore, can it actually help so we don't go down the stage of experiencing stress, excessive stress? The answer is yes, we can. So it's really taking control of ourselves. If we take control of ourselves and our daily lives and our work-life balance and learning to switch off all the things that we said, then we can actually help ourselves.
Ricardo, if you want to add something.
Yes, I agree with that. We need to have a balance between work life and personal life. But also, I think everyone in the major companies have to provide the workers all the tools to make the stress relief. So I can give you an example that we do. We every 2 months we gather the team in the pharmacy, and to relieve the stress, we go to some place, some a spa, to have massages, and always without the family, so only the workers. And one of the things that we do, it's during those it's a weekend that we usually do every 2 months, to find a place to relax and not talk about work. So we have a procedure that everyone who talks about work has a fine that goes gets together to go again to see to make some activities to stress relief.
That's a very good idea. But that's in terms of prevention, right? But we have another question that's very much related to this topic of the stress in the workers and not necessarily in the patients. Mm-hmm. So the question is if you can recommend any checklist or similar tool so that we can identify stress levels also in the co-workers.
Yes.
Maybe we can start now with Ricardo and then we take Carol.
Yes, we have always a checklist. So everything that goes beyond what we usually do. So usually too much anxiety, too much behavior that's not common. We have to be very alert to that, and we always the patients, we always give that advice to them, just to be aware of that kind of mood changes, because we have also different comorbidity of other mental diseases. So we have to be very alert and pay that attention and alert the patients to do that. And we always have a checklist with some questions, that direct questions to the patients that we give them, just to make sure they are alerted and have consciousness to that different changes in the behavior.
Is this a checklist that you can perhaps share in the chat, or if
I haven't got here, but I can give you after. I can give you that. Okay.
Okay. Thank you very much, Carol.
Yes, I think I haven't got a specific checklist, but nevertheless, in terms of written down, but nevertheless, if organizations actually work towards a healthy workplace culture and actually make it acceptable for employees to start speaking up and speaking out about stress, that would be my first point. Because what we're saying here today is it's very important to recognize stress in yourself, do something about it, manage your own stress levels. However, if the organization is not conducive to actually accepting that stress is a topic that you can talk about, then that employee is not going to want to speak up and speak out. So we have to make sure that the employee feels valued for who they are, feels worthwhile for their contribution, actually feels that they matter and they're not just a number. So that's actually helping the employee to feel more of a person and not just as a number. And I think that if we can build that into a listening culture where people actually listen to what it is that you are saying and not try and fob you off with that it doesn't really matter when it does, I think it'll go a very, very long way, because we know we know what stressors there are for employees. There's work overload, work underload. We know that with things like flexible working is helpful. We know that listening to people is helpful. We know that counseling services are helpful. So there's a lot there that we've done over the years, which is really helpful. We now just have to make it to ensure that employees feel actually okay and comfortable to speak up to their managers and to HR and basically speak up for themselves.
Okay, thank you. Do you think that someone can go through depression unknowingly?
Are you going to?
Any of you?
I'll go. Okay, I would say that A person gets used to a certain way of how they are. And sometimes it takes somebody else to recognize that within themselves. So it could be depression, it could be anxiety, it could be feeling aggressive, it could be feeling upset. So those are the kind of feelings that people will be going through. And sometimes you start living to your norm and saying that's acceptable, that's just how I am. But nevertheless, if you took away the stressor, it could be that that person themselves, without any medication, could actually start feeling better, because you're putting control back to them.
Okay. Ricardo, do you want to add something?
Yes, I agree. Nothing to add.
Nothing to add? Okay. So perhaps a more general question. I think Carol focused this quite a lot in her presentation, but anyhow, it's very quite general. How would you, what would be your main advice in terms of how can you avoid stress in your everyday life? Regardless of being a pharmacist or whatever your profession is, but as a human being.
Shall I go, Ricardo?
Yes, please.
Okay, let's just get it quite clear here. You can't avoid stress. You have to learn to manage it. We need to know what causes stress in ourselves. I personally hate being late. That's a big stressor for me. So if I'm waiting for anybody, it's a stressor. If I'm late myself, I've let myself down, it's a big stressor. So know what your stressors are, know what causes you stress, and do something about it before you get to that stage. So we all have different stressors. And so it could be you get IBS, it could be that you get shoulder pains, whatever that may well be. The signs and symptoms are there. The only question is, do you do anything about it, or do you say to yourself, well, they'll just go away? And they may do, but there could be a very high price to pay. So just to come back to what you said there, Filipa, is that you can't avoid it. Stress is daily living. We have that 24/7, whether it's going out in the car, whether it's working from home, whether it's working from the workplace. You can't avoid it. The only thing is, can you learn to manage it? And the answer to that one is a big fat yes.
So my advice is, whenever you plan your day and plan your week, just make sure you plan something for you, for yourself. That will help you to relieve the stress. You can put everything in the hours during the day. You can plan everything, but make sure you do something for you to relieve the stress and anxiety, because everyone has it.
Okay, so perhaps a comment on the role of technologies. So using TV or using TikTok or games to relax. What is your comment about this approach that's more and more used?
Well, I think we need to balance the use, the hours spent using technologies, because that could be one factor of increase of stress as well. So we need to have a balance, and we use our phones and the technologies to plan our day, plan an alarm to decrease the time spent. So because when we are on social media, we spend a lot of time, and we cannot control the hours spent in the social media. So if you put yourself in the time that you are in social media, you put an alarm, for example, 1 hour. After 1 hour, that will remind you that you are spending too much time there. Mm-hmm. So it's a good thing to do to avoid that kind of stress.
I think that's exactly right, Ricardo. Is that the phone is a wonderful, wonderful piece of technology. is also actually can cause us a lot of stress because we don't know how to turn it off. Or shall I say, we do know how to turn it off, but we don't turn it off because somebody may need us. It's a bit like when you take your phone to bed. Somebody may call me at 3 o'clock in the morning. Well, I tell you what, if you call me at 3 o'clock in the morning, I will not be answering you. So I think the thing is that technology is phenomenal. Social media, I think, plays its part in actually causing, it is addictive. It's addictive for all of us. What you're saying, Ricardo, is to actually put some time frames on it, time boundaries onto that, which is exactly right. And I think that's in some ways why our days go by so quickly, because we just lose time on social media or LinkedIn or TikTok, whatever it may well be. And we actually forget about what we're doing. And then you come back, oh my gosh, then you're stressed because you haven't done what you need to do. So therefore, if you put your time boundaries on that, and you actually say it's at a specific time, that helps. But also to be aware that we get addicted to our friends out there, our friends on TikTok, our friends on Facebook. And, you know, you see people in restaurants going out for dinner together and they're all sitting there on their phones. And you're thinking, why are you going out for dinner and just speaking to people on your phones? So does that cause a stressor for us? Well, it just is the way of society. And I think that we all have it within ourselves. We'll bring up our children and our colleagues and our friends and our family to be aware that we need to put boundaries on our phone and our social media.
Okay, thank you very much. So I would like each of you to now leave our participants with a take-home message. So you only can choose one, which is very difficult considering the topic. Yeah, but bear in mind that it's mostly directed at pharmacists. We do have some pharmaceutical scientists, but I guess the bulk will be pharmacists, so consider them as your audience.
Okay, shall I go? I've got it.
Please.
I've got a word. Communicate. Communicate, communicate, communicate. And listen. It's the same. It's the same. Listen to what people are saying, but also listen to what people are not saying. People do show signs of stress. We show signs of stress. Actually have somebody to talk to. The listening and the communicating, there could be nothing more important, because there are times for each and every one of you that you actually need somebody to go to, somebody to speak to, somebody who's not necessarily going to say to you, I told you so, and speak over you. Find a listening ear, somebody who accepts you for who you are, non-judgmentally, objectively, and who cares and understands. And if you can take that role into industry, that's what I've been working for so many years, to make sure that people have that listening ear when they actually go to work as well.
I agree. And my word for that is find something that you can relate to and think about yourself for once. It's very good to have time for you. You need to have time for you. Otherwise, the stress just keeps increasing.
Me time, me time.
Yes.
Okay, very good advice from both. Thank you very much. So we have to close the session. So just some announcements. First of all, I would like to inform all participants that the recording of this episode will be made available at the website. It's www.fip.org. You can also provide us your feedback. I know that many of you are doing so in the chat function, but if you can also send some more structured feedback using webinars@fip.org. We can surely continue improving the digital events. And finally, please visit this website. You can see on the slide, events.fip.org, to learn about more events that we will be having in the future. I would also like to remind participants that registration and abstract submission is now open for the FIP 81st World Congress, which will be this year in Brisbane, Australia. So submit your abstract by May 1st and make sure you register before the 15th of June so that you can benefit from the early bird registration special fee. And you can find more information about the Congress also in the website that you can scan on the slide with the QR code, or just use brisbane2023.fip.org. We would also like to take this opportunity to stress the importance of what our colleagues in Pharmacy Education Journal are doing these times. The Pharmacy Education Journal is a fully open access peer-reviewed journal that has been serving the domain of pharmacy education, workforce development, and associated fields for over 20 years. Pharmacy Education Journal specially supports and encourages early career academics, scientists, and practitioners to publish work with a no-cost route to dissemination, and particularly for those whose first language is not English. So this is quite interesting for many of you that are listening to us today. You can have more information at FIP's website if you go to the section on publications. And also related to this, some of you may have heard about the recently launched Granada Statements. These are a series of recommendations to improve publication patterns in pharmacy practice. They include 18 recommendations, which have been gathered into 5 domains: the appropriate use of terminology in publishing, impactful abstracts, the required peer reviews, journal scattering, using the metrics wisely, selecting the most appropriate pharmacy practice journal. So these are supported by FIP, and we encourage all pharmaceutical scientists to read them. And you can scan the QR code also on the slide to access the full statements. So thank you very much for attending, and we wish you a rest of a good day. Thank you.